So this episode of InStride Live was prompted by Dr. Myers, who wants to see if he and I will join that crowd. Wants to find out if we're missing something. By I certainly don't use a lot of order sets, and I am hoping that you guys that maybe use them and found them really helpful in your workflow might give us an idea of how how you use them, when you find that it works better to use an order set versus any other way of entering the information, and like how you found them to be time savers. I think that I would love to see if I am could modify things and maybe improve the way I'm doing my notes and speed things along. So I appreciate it, and I know um, that Kendall use quite a bit of order sets, and I found them at least helpful. Yeah.
Yeah, I have.
Um,
I
I,
use
I
no order sets at all, Charles.
I have a few. I'm glad to. I'll start sharing my screen here. I have our InStride patient up, and so I have a few. I made a few during that training time when lots and lots of our training was how to use order sets, and I have not found them as useful as templates, but I am also worried that because my muscle memory is what it is now and habits are hard to break, that I need to slow down and really work hard to incorporate an order set 2, 3, or 10, because in the long run, if I can change the way I'm doing things, it'll make things better. So for those that may not know much about order sets, let's just kind of talk about them in a broader term. And order sets are collections of medicines or certain procedures or labs or notes or follow-up intervals that you can select and apply all at once to a certain patient. Order sets show up in this right-hand panel of the window here. You will also see order sets in other places. For example, you will see them if you have an assessment, plantar fasciitis, let's say, and then you go to the treatment section. This button here. That says OS. That'll bring up order sets. And if it is red, it means it has an order set linked to it. And if it is gray, it does not. Um, Order sets can be created in the order set administration area, which is deep in the menus. Mine is now a favorite. And if you can open this, you can see the order sets, and there are all the order sets that there are in here. And the my order sets I've always named with star MH at the beginning, so that'll search for all of my order sets. Which, like you can see, I only have a few, but maybe this one for plantar fasciitis, I added a few medicines, I added a few Xrays, I added some injection things. But to be honest, I don't I don't really use this, and where I think I would really benefit from it is mainly with medicines, because I use the same 4 or 5, anti-inflammatories 80% of the time, and I use the same 6 to 8 antibiotics 80% of the time, and maybe I should have an order set that says anti-inflammatory medicines, or maybe I should have an order set that says antibiotics. Um, I have not found that the favorites in medicines for me have been a total failure. So they have worked reasonably well. So it's not that difficult for me to enter it that way. But that's order sets, where you get them and how you can use them. You can also tie your order set to a template. Now, I do use a ton of templates. And when I said, okay, I'm going to try to incorporate order sets into my workflow, I linked these two order sets. One that we just saw, whereas a lot of my typical plantar fasciitis stuff, and the other one is an X-ray order set, which just has X-rays on it. There we go. So I just said, okay, well, I'll just put all the X-rays I use here to make it handy to get them. But all my X-rays are favorited. So when I go to diagnostic imaging, my X-rays are the same. So like I have failed on bringing order sets to the forefront and making good use of them.
Okay. Let's with the templates. Let me just show you how it. Just go down to the one that says KLB bunion.
This one.
Yeah, it's probably about the 7th one, 8th one, 9th
Yep.
one. Okay, just
I'll
click
add
that
it.
arrow to get that template in there. Okay.
Yep.
All right. So actually, it's already got a diagnosis code in there. I don't know why they would put that in there.
I had it in there from before. I'll get rid of it.
Okay, that's all right. Okay, that was just confusing me. Okay, let me click onto the order set, okay? Or click onto the order set.
Yep.
Okay, and then let's click onto the order set for the very first one, bunion. It says bunion hallux rigidus. Okay, so there are my diagnosis codes, Charles, that I've already set up in there. Or some of those are not mine, but some of them.
Right.
How does that come up? I'm not sure how did that come up to have it so easy for you to click?
Which part?
I don't seem like I use that. I don't know why.
So we got this window to come up by clicking this OS button next to his order set for his bunion / hallux rigidus.
Okay, I see it now. Yeah.
So we click the order set, and then you have to associate an order set with.
You've already entered in these diagnoses.
Yes, I put in all those. I made all those myself. Yeah, and basically some of those come. I don't know why they come check like that. So I just click out up above it the problem list and click the one for that patient that I need. For say it's a right bunion. Yeah, okay. So I would click primary, acquired hallux valgus right foot, and then the diagnosis there on the left. Next to it, yeah. And the other ones wouldn't be there.
These came up checked because they were in the problem list already, because this test patient.
Okay, well then, I would just click that up at the top and, say it's a bunion for the right foot.
Yeah, okay. Now we got all those.
Hallux valgus right foot. All right, and then I would click OK. Okay, and then it'll come up, and I've already put all those in there. That's got the medicines like you were talking about. If I wanted to put them on naproxen, I'd click that box. Then I'd click the other box for the X-rays that I wanted. So yeah, let's click the naproxen, and then let's put 3 X-ray views of the right foot, and then click down on the right and see what I got else down there. Yeah. Okay, so that if I had surgery, I would go in the day I do the surgery, I'd click in that procedure and stuff. Then if I wanted to put them in a pneumatic walker or use a Silipost pad or whatever, I would click that box as I've got down there. So let's just say we've done the naproxen and we've done the X-ray.
Now we click order selected.
Yeah. And then I'd close the box. And if you look down here in the assessment, it's got let's say it would only be the hallux valgus, then it would put the X-ray, then it put the naproxen and all those in the right places.
Okay, then what do you do with the X-ray?
Well, it's already there. It's there.
Okay.
Then I'd go to the procedure, usually when I click on the procedures. Oh, I'm sorry. I would go to the billing part. See, my template I've already made is already in there, and I can change it however I want it.
And then where would you do your X-ray report?
Well, the X-ray report, I actually dictate that. I have the microphone for that. I actually found that easier for me. I would go in and put that in the either procedures, or I put it in the note, the physical exam note.
Okay.
I know you guys want it in the procedures, but I find it easier to do it in the procedures because I keep that in there for every time that I see that patient. It has a copy of my X-ray.
Gotcha.
But I mean, what you just mentioned about having all the X-ray reports, that's probably a good idea. So if you click down to go down to at the very bottom of that where it says billing.
Yes.
See if it'll have that.
And the procedure codes, or where?
Down at the very bottom. Yes. I guess you can go to next appointment.
Okay, next appointment.
Okay, so that's the billing section. It's already put the X-ray in. So for the modifier, I would put an R, and right on the M1.
Yep.
And then put my E&M code.
Okay.
If it's a new patient, it'd be a 99203. And then I would, the appointment, if they'd be PRN, let's just say they came in to have it evaluated, then I would put PRN, and then I would click the done on it, and I would have the note as far as the billing part done.
Okay.
Well, let me see your exam. Can you scroll up so I can see the exam?
We did not do anything for the exam.
Yeah, for whatever reason, the exam, the template didn't come up. It's got the exam, or what I have is for every patient that I have come in, we have like a general template that's got the physical exam, and then I would dictate that bunion specifically for what I would see with that. I use a lot of the dictation stuff. I find it easier for me for that. But if you'll scroll down, you can see the procedures. I've discussed about the bunion, and then I've talked about whether they want to have surgery. And then if they do want to have surgery, I can change whatever procedure I've got, and I don't really have to do a whole lot with that.
And you put all that discussion in a procedure instead of in like the assessment or in the plan.
Yeah, I put for that. If you see how I've discussed it, I put it in the procedures to discuss that. Yeah.
All right,
that's basically my procedures. I consider to be my plan. So I've got everything that I'd want to do or talk to them about. Mm-hmm. And that's in the template.
So Kendall, let's say you operate on this patient 3 days later at the hospital. How would you enter that charge in and use the order set?
Okay. So for that, I would go to, they would have it wouldn't be it'd be resources. When you go to your schedule, it's been scheduled at the hospital. So I would pull that patient up in resource schedule.
Right. I'm not going to go there because that's where you have all
your right. Okay. And so I would pull that.
So I've never used resource schedule. What is resource schedule? I don't know what that is.
It is the schedule for the office that shows all of the patients in blocks, that shows the time and how much time they're taking up, and they're color coded to say what they're coming in for.
Oh, I just use I click the S. Yeah, I click the S up there. So I'm seeing that when I do that.
No, the S, well, maybe. I know for me, the S takes me to the office visit schedule, which is a list of patients and not a grid of patients.
Okay, I'll have to do that later on to see what the resource schedule shows. I've never used it before.
Well, they've got me set up. I don't know how you guys do it, but like if I've got a patient at the hospital, it's at another facility, there's a different box to click that has those. Like if I've got a case at the hospital that day, it'll click it up and pull that patient up, just like your office schedule, but it's a hospital
that would be good for me to know, because I have to log onto the hospital system and to find my patients, and and it would be nice not have to. Then I go to the hub and I enter the charges as an out of office visit. And
Dr. Blackwell, this is Jennifer. Do you, and Lisa, you may be able to speak with that. Is Dr. Blackwell's surgery centers listed as a resource schedule?
It
Yes,
should
they
be, because
are.
I was told
Okay.
just to do that for the out of office stuff, to do it at the resource. Don't ever do it in the other scheduling.
Yeah, Dr. Blackwell opted to do his surgery center billing very much so like providers do their office visits billing. So we created a schedule for his surgery centers, and his front office schedules the surgery. And then from the office visits window, he actually clicks on resources, selects his resource, and then he can pull in a note from there.
and enter charges.
Yeah, and Charles, it's the exact same way. If we click on that order set for the bunion at the very top again, Mike, if you want to go to the very top of the order set, the bunion one, the hallux rigidus,
Yeah.
the very first one. Yeah, and if we go to the, if we just click hallux valgus right foot for the diagnosis, one of those it may already be there. Yeah, and if you look down here on the procedures, it's got the procedure codes. So to build that, all I would do is, like, if I'm doing a 28296, I click on that. If I'm doing a pneumatic walker, I'd click on that. And then I can build a surgery just by hitting that order button.
See, that would save me time. That's a good thing for me to learn. Because that would save me time entering charges and going through codes and trying to, so Lisa, maybe we can work on that.
Yeah, and Dr. Myers, if that's something you want to do, essentially you would actually schedule your surgeries, and Lisa would create a resource schedule for you for all of your surgery locations, which I don't believe you have a lot. And
I only have,
yeah. Yep. So you would schedule anything. So if you see a patient at your hospital, you would schedule them an appointment, and then that would show up on your office visit window, and then you could use order sets. We do get varying reports. Some providers prefer to use the out of office visit and say, I just want to enter in my charges and upload my surgery notes into the patient's documents and have the billers do it that way. If you would rather create an appointment and do it this way, where you can pull in templates and order sets, document it all in there, it's really a preference issue. Several providers have said, I don't want to document it at the surgery center and also document it in ECW. So that would be entirely up to you.
So it sounds like what you're doing now, Charles, is doing an out of office charge,
Yes.
which does not afford you the opportunity to use templates and order sets, etc. What Kendall's doing and what she's saying is she has a resource schedule, and you have a schedule of patients. So each of those patients, you go in, you enter the charges, you lock the note, you create the consult or the surgery, you go into the encounter note, you add the charges, you lock the note. So you treat it just like any other encounter note for a patient you saw in the office, except all you're going to do is enter the billing, unless maybe you bring copies of CT scans home and you could enter those into that same encounter or whatever. But that would be the difference. So I can understand how, if you do 5 things at the hospital and always use the same 5 codes, that maybe just entering an out of office visit is quick and easy and done, whereas creating an encounter note and dealing with an encounter note to enter your charges may for some be more time consuming, and some may prefer it that way. So you could certainly give it a try, but that's the basic difference, is dealing with an encounter note for when you have a resource schedule and not when you use out of office charges.
Yeah, I want to try to explore it and try it out, because it also helps me not miss a surgery too. If I did miss entering into surgery one time because I got busy during the day, and if it's on the schedule and Caitlin's entering it in, it'll help me make sure I don't miss one.
Sounds good. So let's go back to order sets for a second, because I'd like to talk about um, creating your order sets and tying them to a diagnosis. Yeah. Um, so I'm going to open up order set administration, and all yours start with KLB. Yeah. So let's look at that one you said. That's the was it Bunyan one? I think maybe all of these are not your favorites. There we go. So here are all of those things that we saw in the order set when we were talking about that Bunyan patient. Here are the medicines you had to choose from. Here are the procedures. Also here, like, is your Austin and your modified McBride, Keller, bunionectomy codes, like we saw when we were picking them. Here are the Xrays you have. And then if we use this info button, I would thought we would have seen a diagnosis trigger here or a diagnosis link. So I don't know how do you tie your order set with a diagnosis?
Well, when I hit the order set, it has the diagnosis codes that I put up, and it
Okay, so
um,
what if this patient didn't have, what if this is a brand new patient, they didn't have anything in the problem list? How did you link these assessments with that order set? Right? Because these are all the possible assessments that go with that
right.
order set. How did you link them to that order set? Do you remember, or Lisa, do you know?
Yes, when the order set is created, you can set that a certain diagnosis will trigger it. And you can add your link diagnoses when it's being created.
New. Order set
Yeah, you just
description,
click
order
on a
set.
button that shows you how to do that.
So here's a new order set. Not order set measure, right? I don't know what that is. So I have a new order set.
Mm-hmm. And you can
And
click
where
on
do
the
I,
update button at the top.
yeah,
And then that's where you would pick the diagnoses to link it
the
to
link,
or trigger it.
these linked ones. Okay. So if
Mm-hmm.
we go back to this one and we hit the update, I would think there would be diagnoses there or there.
What you can do is click on one of the orange links.
No, I can click on that down arrow
Oh,
and
okay.
I see the codes. Okay,
Yeah, and you can, there's
so
a crash to the right of each code.
I saw that, yeah. So if I go to my test order set and I hit update,
Mm-hmm.
and I can add a diagnosis from anyone.
And then that once you get that into the bottom area, that's where you can add it to the problem list. And it'll automatically add that to the patient's problem list.
So M72.2, I wonder, does it, like, I like it to say plantar fasciitis, but what if I use a different description? Does that matter?
I don't think so.
No, but you're
Okay.
better to put it right foot and left foot. Go ahead and put it on two of them because you're running into issues if you don't do that.
You need them both.
Yeah, you need them both because what happens if you take an X-ray for the right foot? If you have it, it'll come up for the left foot. Sometimes you need to make it right and left.
Okay, so by doing that, it'll link that diagnosis. All right. I must have done that at some point for one of them in the past.
What does the
I do
copy
have
do?
that. I believe it creates a duplicate. So if you find somebody's order set you like, you can create a copy and then rename it.
Okay.
That's great. Thanks very much, Kendall.
Oh, you're
Dr.
welcome.
Matthews.
I hope that helps.
Show me what do you do? Show me one more order set you do. What's another common one that you do? What about for routine foot care? Do you use an order set for that?
Yeah, I do. You go down to a KLB RFC, or that may not be in order. That's just like the fifth one. All right, underneath.
Third one.
Third one.
Third one
order
down.
set. Yeah, KLB. So yeah, it's got
So
all
here's
those codes in it. Corns and calluses, nails. So it encompasses whether it's going to be at risk care or non at risk care, because I can click on the diagnosis codes to go with it.
Right.
So let's say it's diabetes with PVD and mycotic toenails. Let's hit OK. And these are your billing codes.
Yes.
So pretty much that order set is to help you with billing.
Yes, exactly.
Gotcha.
I use it all for the billing, basically.
And do you have found any quick ways to enter your class findings and stuff?
No, I do that when I go to the billing and just put those on the modifiers before I finish it up.
What about in your
I'm sure there's a
exam?
better way to do it, but I don't know how to do it.
What about your exam for class findings?
Well, that would be in the note that I'll have. Anything to document the class findings about the pulses and hair growth and all
Right.
that. That'll be in my physical exam part.
And do you use any of these, like this InStride class findings one here?
No, I don't use any of that.
Do you dictate down into here?
Yes, if it's usually going to be in the template, I'll have it in the template that I've got for routine foot care. If not, then I'll dictate something different if it's a little different, kind of situation.
So this is your routine foot care template.
Yes.
And then you go in and change in that HPI what applies and what does not.
Absolutely. You can see that I've got them all in there, and I've just found it easier for me to copy them and delete them than it is to have to type stuff.
I got you. That makes sense.
And that's not very detailed as far as that. I mean, for the class findings, I would actually be dictating some stuff in that. That's just for if you can see, that's basically just for the non-covered routine foot care there.
Oh, okay. I get you.
I'm pretty specific about if it's an at-risk patient, then the dictation for me is just so much easier now that I can be a little bit more specific and I don't have to worry about missing anything.
Yep. Do you use Dragon or do you use something built into ECW?
I use it's not Dragon, it's Fluency Direct.
Okay.
It was much cheaper than Dragon, and it works just as well from what I've heard. It's doing well for me.
Great. It works good for you. Yeah, that's terrific. Dr. Matthews, tell us how you use order sets.
More so like a compendium of treatments.
Do you have yours? Do they start with anything in particular?
Yeah, mine start with SAM, capital SAM, and go to
All right.
plantar fasciitis. Because this is the one I use the most. And the reason that I like the order set is you can see that the X-ray choices are in there, whether it's an ankle or foot, right or left. well, I guess it's not ankle. It's foot 3 views versus 2 views.
Yeah.
I think I stole the meds probably from you guys, one of your templates.
Yeah.
But for me, what makes it easy to do is you simply click if you're going to give them one of those anti-inflammatories, whether it be the NSAID or the steroid. Click on the X-ray you're doing. And then for me, though, the big time saver is I usually do an injection. If you go down to the 4th choice under procedure, I usually do the ultrasound guided. And of course, usually use those 2 steroids mixed together.
Yeah.
Usually a night splint if it's a new patient. So I find, and I do a lot of these plantar fasciitis patients. So as far as treatment goes, being able to click every single, each and every one of these from the X-rays to all of the things I'm doing, it's just, it makes it much faster. And I have a plantar fasciitis template as well, like for physical findings.
Yeah.
But this, sitting and plugging in all of these different treatments can be real time consuming. But with this order set, you just go to it and click on everything that applies. So you might give them the meloxicam plus the injection. They might already have a night splint. It's just easy and quick to tailor whatever the particular treatment is. And this is actually the one I use the most for some reason.
Because they're everywhere, these people. Now, you also have some verbiage that goes with your injection or your night splint or your ultrasound and stuff like that. Does that come from a template? Right, because your injection,
yes.
somewhere you've written, I injected the right heel and blah, blah.
Yes.
And that comes from different templates.
Right. That's not under order sets.
So,
I probably could. It's just that when I did these orders, that was what was first online, and I didn't really understand how to put the verbiage in. So I have a different place. I have a template that pulls up all the treatment that explains the injection, where I gave it, what was in it. There's some phrasing that I added about the ultrasound guided injection and what we saw.
Is that a separate template for each of those things? One for the injection, one for the strapping, or is that one template and then you take out what you don't use?
Yes,
it's one template that I take out what I don't use.
Yeah, mine's the same way. I just delete what I don't use.
I find that to be and if going back to routine foot care, I sort of have a routine foot care template for a note. I don't use order sets for that, but I stole this from somebody else. This was already on there. I took and modified it, but yeah, for that
we
sort
should
of
all
thing,
do that.
It's a lot easier, I think, to have, for example, the pulses. There are 4 or 5 choices, and you can quickly highlight and backspace, and you've eliminated all the choices that are wrong, and just have the correct statement about the pulses.
Absolutely, yes, you are right.
That's in a template that you just delete what you don't want or change. Okay.
Yeah, that's a template for physical findings for the exam. But for me, where I really get bogged down is on treatments, because you would have to go in and manually enter the X-ray that you did. the shot, what, you know, the drugs in the shot, the ultrasound, the night splint. And for me, there are so many things that I do for that plantar fasciitis patient that it really saves time to just click all the boxes that apply, and boom, then you're on to billing.
Yes, except you have to add all that verbiage and then remove what you're not keeping in.
Right.
That's great. And there are so many ways to skin this cat. That, and I am glad that you have found ways that you are happy with and work for you. I can totally
honestly,
see.
I should do like Kendall, like this plantar fasciitis. I should move all of my phrases into here in a note section. But when I first created the order sets, I didn't even realize there was a note section to add all verbiage. But it could be done the same way, because I did at some point realize, because I do have a few order sets where the verbiage is right in there. And that
Yes,
actually
you could.
is more of a time saver, because you go to one place, you click the injection, you click the J codes, you click on the verbiage, and then it's just a matter of saying right or left foot.
Absolutely. If you put your, here's what I say to every initial patient, and I have another one. It's here's what I say when I do the injection, and here's what I say when I do whatever, and then you pick the medicine and the X-rays you took and the things you did and which verbiage applies to which of those things you did, and it all end up in your notes.
How do you apply the verbiage to the procedure? I see where you can put the verbiage in on the bottom. This is Tom Bubrowski, and I haven't started with ECW
Hey, Tom.
yet, but I'm trying to learn as much as possible. So how would you differentiate the verbiage for like your injection?
Sure. So what you might do, and this is his, let me go to mine, because I don't mind. So here I have some verbiage if I'm going to do an injection. And let's add one that says, this is my discussed plantar fasciitis, causes, treatments, etc. Right? That's the stuff you say to every new plantar fasciitis patient, right? So
Right.
if I go and let's say I'm going to go and I'm going to use my plantar fasciitis order set here. And I'm going to add my diagnosis of plantar fasciitis, and then it will have all the medicines I like and maybe the X-rays I want, and then at the bottom it will have the verbiage. Oh, I probably didn't save it when I altered the last one. I'm sorry, but you would have these choices of these notes, and I want to add this one. I want to add this medicine, and I'm going to add this X-ray, and I'm going to order all of these things. And then that blurb about the plantar fasciitis injection that we just talked about is going to be here under plantar fasciitis, medicine, X-ray, and then that's the injection notes that we highlighted when we did the order set.
Okay. So when you dispense a night splint, there's a description that goes along with that too as well. I mean, you're going to put that in the...
Absolutely. You put that in your... Oops. So here's my plantar fasciitis order set. And that's where I didn't. But here I will say, discussed with the patient possible benefits of a night splint, and then your whole blah, blah about that. And you could put it there, right? And, oops. And just want to make sure I save this. No. What am I doing wrong? Oh, save note. Sorry. Discussed with patient night splint. Save. So then if I'm at my order set, for plantar fasciitis, there's the night splint and there's the other one. So you can have as many of those as you want, and you click the ones you want, and maybe you're not doing any medicine or anything else, and you just order those two things.
Gotcha. Okay. Thank you.
Yeah, sure.
This has been informational. This has been good because now I can see how order sets can save you a lot of time.
And they're easy to make too, Charles. They don't take very long at all once you get on a roll with them.
Yeah, I agree. I'd probably spend a couple minutes and search for plantar fasciitis and see how many. There's a couple, right? And see what you can find for plantar fasciitis, and then pick one you like, copy it, and start from there. And if you make them your favorites, they show up. They show up here.
Mike, I have one question. I got one question. Maybe you can help me with, and anybody can answer this. Okay, so let's say you have a routine foot care patient, non-covered service, just as an example, and you see them, and then they come back for their 3-month visit or whatever. When you build that treatment out for that, and then they come out the second time, and you pull your template up, that treatment is no longer in that note, but the procedure is that you build out. Do you have to put that back in the treatment? Because I found when I tried to do that, it came up as 2 units when I tried to build that out. When I, just click on the buttons. My understanding was, all you need to do if everything's the same, the note should be the same. You just click on and then you're ready to go. Am I missing something with that?
I think I'm missing about what you're talking. So let's say we have a routine foot care patient comes in and you add your routine foot care patient template, whatever that is. Is that what you're saying so far?
Well, you bill the patient, you put the routine foot care non-covered service in the treatment, and then when you go to bill it at the end, the procedure, it'll come in the line for the billing, the procedure. Okay.
Okay. And that's coming from your template.
When the patient comes back, say 3 months later, and when you pull that template up, that treatment, that routine foot care is no longer in the treatment section. It is in the procedure part.
Wait. So the patient comes back for the 3-month visit, and you use the same template you used when they first came.
Yeah, you just pull it up. You just pull up that previous note.
Okay, wait.
Say,
so
like
that's
in the
different
treatment,
that's different than the template. So hold on a second. So patient comes in 3 months later. You're not using a template. You're bringing up a previous note.
Previous note, correct.
Okay, so you're using like the down arrow here.
Yes.
In the history, in the exam, in the assessment, and then there's none in the treatment.
Well, what happens if you look here where you're on your screen here where it has like treatment, it'll have like procedure, the codes that you got.
Yes.
Okay. When I have pulled that up for the patient coming back, that part's not there anymore. If you go to the very end of it scroll down to the very end to like the billing part where you go to like next appointment, click onto that or the visit code.
Okay.
All right. Click onto the visit code down here on the left.
Okay.
All right. I mean, like, not the code itself, but code. go to the billing information down here on the left of this, and hit the tan visit code. Okay, yeah. So when that note comes back, it'll have in there the non-covered routine foot care, and it'll have one unit.
Procedures. Yes.
Yes. So you should be able to just to hit done, right? You don't have to put it back into treatment, do you? Because if you do, it comes up as 2 units.
Well, where do your diagnoses come from? Because they don't pull.
Well, they're already in there. They're already at the top. Everything comes back as before. It's not changed anything.
And that comes from when you use this down arrow next to assessment.
Yes, yeah. It does. Nothing's changed. You're just pulling in the same visit, same procedures, same everything. I just want to make sure it's going through.
Well, if your Shelley Do hasn't called you, I'm sure it's going through.
Yeah. Okay. Yeah, that's what I was hoping.
Because she will let me know.
Okay.
So I have a question with the down arrow. Can you go up to when you have the down arrow and it has merge and copy? What's the difference there?
Yes. Merge adds to what is already there, and copies replaces what is already there.
Okay.
So if I click this and I pick history, yeah, and I say copy, it gets rid of everything that was here before and puts in what I selected.
Do that again slowly. Show me again.
Sure. So if I click the down arrow,
okay,
and I go into this other visit that says history, and it says patient is seen for concerns of pain in the right midfoot, and I say, oh yes, I want that history, and I click the arrow, click the checkbox next to history. If I hit the merge button, so I'm going to hit merge, and everything gets added at the end. If I had hit copy, it replaces everything that was there.
Okay.
That's the difference between merge and copy throughout the whole system.
One other question, Mike. Do you guys know of any way when you're doing the review of systems, you got all those commas about the denies and admits? Is there any way to speed that up? That seems to be, my assistant does it, but I mean, it's kind of cumbersome. Anything you guys have figured out to make it a little faster?
Yes, I don't use that review of systems.
Okay.
You are welcome to use the one we use, but I found all those others to be way more than I need. So I made this one, WFAC review of system, and it has, somebody added some to the bottom. So it ends at allergic. I think there's 2 integumentary notorious, but they're at the bottom. So I use this. And I tell you, honestly, what I do in the office is I say, are you feeling good today? Other than your feet, are you feeling good? Are you feeling healthy? Are you able to get up and run around, do the things you want to do? Great. Do you have any chest pain, palpitation, shortness, breath, coughing, wheezing, trouble breathing? No? Terrific. Are you eating, sleeping, and going to the bathroom okay? Awesome. Do you have any other pain besides, any other muscles, bones, joints, tendons hurting besides what's in your feet? No? Okay, great. And I go in here and I add my little blurb that says, no other musculoskeletal symptoms. And sometimes I'll ask them, if they have diabetes, say any burning, tingling, pins and needles, numbness in your feet. No, great. And I'll use my normal for this. So that's exactly how I do my review systems. On new patients, on follow-up patients, I ask constitutional, and I ask, depending on if we're doing a musculoskeletal or an integumentary problem, I ask them if they're having any other muscle pains or any other rashes or bumps or found any warts anywhere else like that.
Okay. Thank you. Yeah,
so
I think we use that. We use that right there now. That is good. I think I borrowed that from you.
Help yourself, my friend.
Yeah, it worked out well.
I'm going to get rid of these last 2 things. I don't know where they came from. Maybe I screwed it up.
I usually do more of a problem focus. I don't do a complete review of systems. I usually go to the 3 dots right there.
Yes, I remember you telling us that you have things already kind of pre-done.
If you go to those 3 dots, you'll see what I have right there. I do 3. And I just kind of add or delete if they have back pain, joint pain. Yeah, I just use those right there.
Yep.
And I put them there if I need to.
And then this review system shows up like this.
Super. Thanks.
Yeah, man. You're very welcome. If that is not, so you may have not been to this configure categories menu in a while. So if we look up review systems and we look up your name, those are the review of systems choices you see. Oh, there's the one I made. So it'll be showing up for you in your office for you tomorrow. It's already there. So you can use that anytime you want. It's worked out fine.
You.
Yeah, yeah, but it's already there for you. All right, cool. Well, Dr. Blackwell, Dr. Matthews, I appreciate it. Dr. Bubrowski, I was glad you were here. You were always welcome, and we'll be glad to help and get you off to a great start. No problem. Jen, Annalisa, thank you all very much for staying up so late with us. Appreciate it. And you all have a good night, and we'll see you soon.